So let's talk a little bit about the treatment for menopause. Really, there are two main camps of treatment. We have menopause hormone therapy treatment, and then we have non-hormonal types of treatments, which include moisturizers and vaginal lubricants. If we look at the treatment for menopause, we want to refer to the recommendations that are put out by the North American Menopause Society. And this society has put together a 3-step process. The first step is the most conservative management option for menopause and vaginal dryness, and that's the use of local non-hormonal options. So when we're talking about non-hormonal options, we're talking about vaginal moisturizers as well as vaginal lubricants. And we'll talk a little bit more in detail as to what these two types of products are in another video. The second step with regards to treating vaginal dryness is a local hormonal type of therapy. And what this is a low dose of vaginal estrogen that is administered to the tissues of the vagina. And it can be administered in many different ways. So there can be gels that are used. There can be tablets that are inserted vaginally that can help with the local estrogen administration. There's also estrogen rings that release estrogen into the vagina. And these are all different types of local vaginal estrogen. And what it does is it actually helps to improve the overall health of the vagina and the vulvar area. And it can actually help with symptoms of vaginal dryness as well. The third step to this 3-step recommendation by the North American Menopause Society is the use of systemic hormonal therapy. And with this particular type of therapy, we're really using this for global symptoms. So some of the symptoms that I mentioned earlier, such as aches and pains in the joints, insomnia, hot flashes, because it's involving many different parts of the body, we want to use a more systemic approach to treatment. So a systemic hormonal therapy can be administered in a couple ways. Typically, it will be used transdermally. So typically that is a pouch that's put on the skin, and the estrogen is absorbed through the skin into the body. And then the second main way to administer the estrogen is by mouth, by taking tablets orally.